Hello again, I'm Juanito Calipbert, or JC. As mentioned in my introduction, I will be sharing with you my working and professional experiences and journey here in the UK as a physiotherapist, hoping that I can help other people who are in the same situation, especially those who are internationally trained. So, in my other videos, you'll be seeing different topics in that journey, and hopefully, you can learn from each of them on your specific needs. If you're already a CSB member in the UK and you think I can help you in a one to one basis, just check CSB's mentoring scheme and look for my name. Hopefully, we can help each other. Okay, so in this video, I'll be sharing with you one of my job interviews, another interview I did. This time, it's for a Band 5 rotational physiotherapist job role, hospital based. Okay, I had several of this, so this will be the first one. Okay, so first question. Give two of the trust values and share to us how you demonstrate these values at work. So, for those who are not familiar, working in the UK, in the NHS, so the different organizational um, trusts here in the UK would have their specific um, working values that the employees should adhere to. For example, in my workplace at the moment, the trust values are um, being open, being fair, and being caring. So, yeah, different trusts, different values, and it's useful for job interview questions, especially for band fives. I think even for the band six that I did, would be asking for um, trust values questions. Um, they want you to demonstrate that your own personal qualities would be applicable, or yeah, would be demonstrating their trust values. So just prepare for that. Second question, it's a case. So a patient post laparotomy, and then the oxygen is at 87%. They're on oxygen 4 liters and in nasal cannula. Okay. Tell us your assessment and treatment. So it's a post-surgical respiratory patient. So how will you assess and treat? It's just a basic demonstration of assessment and treatment, acute setting. Okay, third question. In the medical ward, your senior is off sick. You were asked to see two patients on her caseload and told that they are fit for discharge. One is for stare assessment, one is not yet reviewed. What will you do and how will you prioritize these patients? Okay, so it's just demonstrating how you will liaise, how you problem solve, okay, in your team. Number 4, outpatient, 35-year-old acute or chronic low back pain, and radiating to the right leg. So the first question is, how will you go about your assessment on this patient? And then after answering that question, they usually complicate the question by asking a secondary question. So on that same patient, your findings show that he also has pain on the left leg and there's urine incontinence. What will you do? Hopefully you get that it's a red flag. Okay, next. 91-year-old right ischemic stroke inpatient. Nurses said last night the patient was walking independently in the ward, but when you saw the patient, he was confused, abrupt, and weak on the left arm and leg. What are your thoughts, and what could be the reasons behind? So, just an idea that it's a stroke patient, and yeah, if you have an idea of how the disease nature is, you might get the point. Number 6. Tell us what you know about clinical governance and how you practice them at work. So, in a band 5 job role, um, I think it was very common to have clinical governance questions. Um, so, make sure you know um, what what is clinical governance and how you are actually doing them already, practicing them at your work now or from your job experiences. Right, so that's the interview questions for this um, interview. Hopefully, you can learn something from it and prepare in case you have them. Good luck and see you on my next videos.